Let's understand why kidneys fail. Part 1 covers the 4 biggest medical causes. Cause number 1 is diabetes mellitus. This is the number 1 cause of chronic kidney disease worldwide. When blood sugar stays high for years, it damages the tiny blood vessels in your kidneys. The glomeruli, your filtration units, become thick and leaky. Protein starts leaking into urine, a condition called proteinuria. This is diabetic nephropathy. It progresses silently for 10 to 15 years before symptoms appear. Uncontrolled HbA1c above 7% dramatically increases risk. Cause number 2 is high blood pressure or hypertension. Your kidneys are essentially a ball of blood vessels. When pressure is constantly above 130/80, it causes shear stress, scarring, and narrowing of renal arteries. This is called nephrosclerosis. High pressure also forces kidneys to work harder, causing hypertrophy and eventually fibrosis. Hypertension and kidney disease create a vicious cycle, each worsening the other. Cause number 3 is glomerulonephritis. This is inflammation of the glomeruli themselves. It can be triggered by infections like strep throat, autoimmune diseases like lupus, or IgA nephropathy, where antibodies deposit in the kidney. The glomerular basement membrane gets attacked by your own immune system, causing blood and protein in urine, swelling, and reduced filtration. Cause number 4 is polycystic kidney disease, or PKD. This is an inherited genetic disorder. You are born with mutated PKD1 or PKD2 genes. Over time, dozens of fluid-filled cysts grow inside your kidneys, making them enormously enlarged, sometimes as big as footballs. These cysts crush healthy nephrons, cause pain, hypertension, infections, and lead to kidney failure by age 50 to 60. Cause number 5 is urinary tract obstruction and kidney stones. When stones, enlarged prostate in men, or tumors block the ureter, urine cannot drain. This creates back pressure called hydronephrosis. The kidney swells, urine stagnates, and bacteria grow, causing pyelonephritis. Chronic obstruction, even partial, destroys nephrons over months. Large stones, larger than 5 millimeters, often need lithotripsy or surgery. Never ignore flank pain or difficulty urinating. Cause number 6 is medications and toxins. The most common culprits are NSAIDs, nonsteroidal anti-inflammatory drugs like Ibuprofen, Diclofenac, and Ketorolac, especially when taken daily without water. They constrict the afferent arteriole, reducing blood flow to kidneys. Other dangers include certain antibiotics like aminoglycosides, contrast dye used in CT scans, and herbal remedies containing aristolactic acid. Always hydrate and avoid self-medication. Cause number 7 is recurrent infections and severe dehydration. Repeated urinary tract infections spread to kidneys. Meanwhile, chronic dehydration, heat stroke, severe diarrhea, or low water intake makes blood thick and acidic. Kidneys must concentrate urine heavily, overworking the medulla. This causes acute kidney injury, which if repeated, becomes chronic kidney disease. In Nepal's hot terai and during trekking, this is very common. Cause number 8 is lifestyle and family history. Smoking narrows renal vessels and increases proteinuria by 30%. Obesity forces kidneys to hyperfilter, causing glomerulomegaly. Eating high salt, processed meat, and sugary drinks increases risk. If your parents or siblings have kidney failure, diabetes, or hypertension, your risk is triple. Get your creatinine, eGFR, and urine protein checked yearly after age 30. Prevention is always cheaper than dialysis.